Here on 1FM 91.3, Good Times, Greatest Hits. Good morning to you and welcome to the Brightside. Time for a very special chat this morning with someone I super duper love talking to because she is so knowledgeable in the area of hypnotherapy. She is Monica Menon from the Healing Place SG, in to talk about what is hypnotherapy and how it can help us. So good morning, Monica. Welcome to the show.
Good morning, Carol.
Thanks so much for coming on. Now tell us, what is hypnotherapy? Because for a long time, a lot of people thought, is it taboo? Is it a bit of hocus pocus? What exactly is hypnotherapy?
So hypnotherapy is basically a therapeutic technique that is used, that uses hypnosis to get people into a very deeply relaxed state or a state of trance. So that, in a nutshell, is the definition of hypnotherapy. But what it does is it basically alters your state of consciousness and accesses a lot of the resources in your subconscious mind. And through the access of those resources, you're able to then explore emotions, your feelings, or, any challenges that you may face. And then through that state of trance, you're able to then eventually resolve it. Of course, with the expertise and assistance of the hypnotherapist.
Yes, I would like to think so. Yeah. So actually, are you awake? Are you conscious when all this is happening? Or are you kind of like in a sleep state?
So it's not exactly a sleep state because you can hear the voice of the hypnotherapist, right? And you are responding to whatever the hypnotherapist is telling you. So a couple of days ago, I had a client who asked me exactly the same question. He said, "What happens if I fall asleep, during the session?" So my question back to him was, "But when I did the waking process with you and I counted up and I said, by 7 and 8 you'll open your eyes and 9 and 10 you'll be wide awake." I said, "Weren't you responding to me?"
Wow.
Right? So in as much as you say that what happens if I go to sleep, it's not as if your subconscious mind is not listening, and when I taught him how to practice self-hypnosis on himself, because that's what you can do when you come for hypnotherapy, he said, "If I'm going to try and do this for 15 minutes, how would I know that 10 or 15 minutes has gone by?" And I said, way back in the past, when our grandmothers and great-grandmothers did not have alarm clocks, but they knew that, their body clock would wake up at 5:30 every morning, they gave they gave that suggestion to their subconscious mind to wake them up at a particular point in time.
Yeah.
So we can actually give ourselves those positive suggestions all the time.
Now, the idea of hypnotherapy works because, how many percent of our mind is actually subconscious? How much of the thinking and processing is actually subconscious?
So a large portion of your mind is actually subconscious. So if you were to think of like an iceberg, if I were to draw an analogy, so the top of the iceberg already to you looks like it's very big, but if you go underwater, you will find that the subconscious, and these are our brain is actually a lot like a computer, or data that's stored in there. So you think what you're working on that particular day, that's the conscious mind, but all that is stored in the computer is actually the subconscious mind. Many of it, much of what's in our mind may have been forgotten, but if we were to be able to access it or to go back to something that happened in the past, we'll be able to resolve it. So that's why things like phobias or whatever, it stems from something that may have happened earlier in your life.
Yeah,
right?
And it's tripping you up without you even being aware of it.
Yeah, or realizing why. You see,
okay.
so if we're able to get to it, then we're able to resolve it.
All right. Well, we'll continue this chat on Facebook. Do join us, facebook.com/1FM913. Send us your questions or your thoughts on hypnotherapy, 88550913 on WhatsApp, or as a comment on our Facebook live session this morning as well. More with Monica Menon in just a bit. Hi, good morning, everyone. Welcome to Facebook Live. Thank you so much for joining us. We're chatting with Monica Menon. She is a hypnotherapist from Healing Place SG. Monica, can you tell us what are some of the applications of hypnotherapy? What are some of the clinical applications?
Yeah, so hypnotherapy has been used in a variety of clinical issues, okay? And I mean, I'll share a few, but it's not limited to these. So anxiety and stress management is one of those that a lot of people come to hypnotherapists for. Then also sometimes a related or not related one is anger management issues. Pain management. So there are a lot of people who come to hypnotherapists for managing dental pain before before they go to the dentist, or even before they go to surgery. There are women who want to have hypnotherapy done so that they can go into a delivery without necessarily having to take painkillers. So it's a matter of having the control in the subconscious mind. So when I did my course, I remember a couple of other ladies who were doulas. And they came for the course because they were going to use hypnotherapy as a complementary therapeutic service.
It's so true what they say, mind over matter.
Yeah.
Wow, this is definitely bringing a new revelation, a new light on something I thought was not possible. Willie wants to know, is there any side effects from hypnotherapy?
Well, basically there aren't any side effects if you are hypnotized by a trained hypnotherapist. So I mean, we've never seen anything other than perhaps a little bit of drowsiness or lightheadedness when you come out of the therapy. During the therapy, if you're accessing something that is of the past, and it could be something that was either a little bit of pain or whatever for you, emotional pain, you might cry. So that's what we call an abreaction.
Right.
But there's nothing wrong with any of those, because those are very normal, human reactions to a situation. So there are no side effects per se.
Hannah wants to know, is it a new age treatment? Because she says it's quite scary that it can bypass the mind or your consciousness.
We're not bypassing the mind. We are accessing the resources in the mind. And it's not a new age procedure. In fact, hypnotherapy is one of the oldest healing techniques known in the world. So in the ancient Egyptian world, they had what we call sleep temples. So this was exactly what it was used for, where people were asked to access certain emotions or certain resources in their mind. The ancient Romans also used it, and it's been used in ancient Greece as well. And then of course we know that the closer link to this is meditation in the Buddhist and Hindu world, right?
So meditation is considered a form of hypnotherapy?
No, it's the closest cousin to hypnotherapy would be something that people can associate with, and that is meditation. However, the difference between meditation and hypnotherapy is that in meditation you do not have the voice of the hypnotherapist, and you do not have specifically crafted suggestions that are suited to your clinical condition, whether it's anxiety or pain management.
Okay, we're just going to jump back live on air, and perhaps you can recap some of these thoughts that we just discussed about the clinical applications, especially of hypnotherapy. I don't think people are aware that it can be used in such a wide range of situations. I thought it was just limited to like something really serious, or I'm just kind of like breaking down somehow all the time. But no, you can be used for quite a number of things, like even curbing your snack, your desire to snack all the time, right?
Yeah.
All right, hang tight. Back with more of Monica in just a bit. 1FM 91.3, Bananarama. Ooh, is she singing about our guest, Monica Menon? She got it. That was Venus here on 1FM 91.3. Welcome to the Brightside. We are chatting with hypnotherapist Monica Menon this morning from the Healing Place SG. And the topic of hypnotherapy seems to be gaining a lot of traction these days. We see it more and more in clinical practitioners because of its it's very effective in helping you curb some things. What are some of the clinical applications applications of hypnotherapy, Monica?
Yeah, so there are several, and I'm going to give you a few examples, but these are by no means exhaustive. So one of it is anxiety and stress management. A lot of people go to hypnotherapists for this, and anger management is another one. And earlier you mentioned something to do with curbing snacking. So
even that.
Yeah, so breaking unwanted habits like even smoking cessation.
Wow.
Nail biting. So all these are unwanted habits. So it comes, the snacking would come under that category as well, or it could come under weight management.
Oh, wow.
Yeah, so we help people with phobias and fears as well. So these are some of the clinical applications of hypnotherapy.
Okay, so could you give us an example of how it would work? For example, if someone were very anxious, just going through like chronic anxiety, how would the process look like?
So it's very important for the hypnotherapist to do a detailed case history. Okay, so that's why usually the first session is the longest, because you need to find out a lot about the medical conditions of this person and family history, what work they do, etc. But then later on, based on what it is they want to change in themselves, that's where you ask the more specific questions. Okay, so like, what do you do in your line of work, or when was the onset of this anxiety, or this fear that you have, and what sort of a fear is it? What happens to you when you feel anxious? How does your body react, or your mind react, or any clamminess in your hand? What actually happens to you? Are you trembling? So it's important to find out as much detail, even to the point of how long does it last? What happens after? When it's petering off. What happens to you after that? How frequently do you get these anxiety attacks? So based on what the client tells you, that's when then you will decide on the therapy goals, because you have the overarching therapy goals and you will have the individual session goals. So the overarching therapy goal would be to ensure that your anxiety reduces, or that you become more confident and self-assured, right? That's the overall one. But the specific therapy goal for that session could be to be more relaxed, because that's probably one of the things you need to start off with first before you can reach the overarching goal. So you have your specific therapy goals for each session. Sometimes they overlap, but essentially it's the smaller goals that will lead you to the bigger one.
Okay. As you're actually walking me through this, I think I've actually been through hypnotherapy. It's just that it wasn't labeled as hypnotherapy during some of my therapy sessions. For instance, if I was feeling triggered, my therapist might actually say, okay, I want you to think about how you're going to respond the next time you are triggered. Think about, staying calm or breathing. Is that correct?
Yeah, but that would come when we are in the conscious world, right?
Yeah.
Where your therapist would tell you, I'd like you to think about that. How do you respond? So that becomes the homework, either the journaling or whatever. But the actual hypnosis session is a process, because you need to go into a bit of the induction, where we need you to get your eyes closed, then a deepener where I take you even deeper into the state of trance, and then feed in the therapeutic suggestions, which is specific to that particular session. So if that day we are doing a relaxation, then my script would be related to that. If that day I need to build your confidence, I would use an ego strengthening script. So it depends on what that specific session is about. So that's the third part of it, where it's the specific therapy and the therapeutic suggestions. Yeah.
Fascinating stuff. Oh my gosh. I'm thinking about a earworm when we hear a song. For some reason, the song keeps playing in our heads throughout the day. The power of the subconscious mind is indeed very profound, More with Monica in just a bit, but in the meantime, you can join us if you have any questions on Facebook Live as well at facebook.com/1FM913, and send us your WhatsApp as well, okay, 88550-913. Back with more in a bit. Oh my goodness, there's so much to learn. Gurmit wants to know, can someone hypnotize me without my permission, like in the spy movies?
No. So whatever happens, like you say in the spy movies and all that is what we call stage hypnosis. And unfortunately, stage hypnosis has given, in a way, a bit of a bad name to hypnotherapy, as a form of therapy, because that's the only part that people know. So there was a big gap from the ancient world to the early 20th century when people started to use hypnotherapy, or rather hypnosis on stage, not the therapy portion, but just the trance portion. So the key thing for clients to know is that you cannot be hypnotized against your will. And at all times, it is the client who basically directs and controls the session. You reveal as much as you want to or keep as much as you want to yourself. The job of the therapist is just to make sure that the process is correct, that you are safe. It follows a particular protocol. So you cannot be hypnotized against your will.
Okay, that's good to know. I don't want me falling off, like shopping against my will. I think that would be terrible. Any examples of what people uncover through hypnotherapy? Like, say, how John is afraid of women as an adult because Sally called him something naughty when he was young.
Yeah. So there are things that get uncovered because a lot of the time, whether it's our phobia or our fear or, something that has triggered and made us angry, like an anger management thing, it doesn't happen overnight. It is as a result of things that may have accumulated through the years, or something that happened in your childhood, or some bad experience, So it's about getting to the root of it, which is why it's the bottom part of the iceberg, right?
Yeah.
So it's getting to the root of it and later then addressing it. And you can actually resolve it in your subconscious as well. Even things like forgiveness and all that. You may have had a bad relationship with one of your parents, and that parent is no longer around, but you carry that with you. So hypnotherapy helps you to resolve that in your earlier years. I mean, like your younger self. So we have a script called Inner Child Work, and you as the adult now gives that comfort to your own inner self. So those are the technical bits about why we use certain scripts, but that's why going to someone who is trained, who knows what they're doing, who is able to then use their voice in a calming manner. That is essentially what you need to do, So the command of the language is equally important.
Yeah. Well, hopefully that allays your fears, Hannah, because Hannah says, letting your mind be controlled by another, she's not quite comfortable with the idea of that.
No one controls your mind. Only you are in control of your own mind.
Right.
And I cannot emphasize this enough. Nobody else does a mind control over here. So the control is in the hands of the client.
Okay, that's good.
Yeah.
What about repeated treatments? Is one session enough?
No, one session is never enough. Minimally, there would be like about 4 to 6 sessions, but the number of sessions is dependent on the severity of the condition. There are some that after 4 or 5 sessions or 6 sessions, you're well on your way because you have already mastered the art and the technique of being able to help yourself. What I love about hypnotherapy is that it empowers the client to be able to do certain things, their own self-hypnosis, their own breathing techniques. It empowers the client. I mean, of course, we sometimes use it together with counseling or together with CBT or other modalities that are available in the psychotherapy world. But essentially, it empowers the client to, be off within 5 or 6 sessions. However, for more serious cases, it could take a little bit longer.
But would you see effects after the first session already? Or?
Yes, definitely. There are clients who tell me that even after the first session, they feel very calm because the first few sessions are stabilizing sessions.
Okay, that's good to know. I mean, because sometimes when you go for regular therapy, it's not usually done within one session. I mean, it depends. It depends on what condition you're going for, what issues you're trying to treat. Sometimes you come away with a lot of insight that is beneficial to you almost immediately. Gavin also wants to know, are children suitable for hypnotherapy?
Yeah, actually anyone can be hypnotized, and some of them do not need to have their eyes closed. So typically with children, we usually get them to either do a little bit of coloring or something else while we're talking to them. So the most powerful would be with your eyes closed. But having said that, if I were to draw an analogy again to driving, a lot of the time we are either talking to someone on the phone in our car or even someone sitting next to us, but we're not actually conscious about how I need to stop at this light, or I need to turn left here or right.
Yeah.
Because you are already in that, in a way, a state of trance. And you're able to get to your destination. And everybody goes to different places at different points in time in their car. Nobody is consciously thinking, except perhaps at the start, okay, I need to get to this particular place. I need to get to SPH radio or something, right?
Yeah.
So I know that's where I need to go. But in between, I'm not really consciously thinking about it. So similarly with children, sometimes we do it with their eyes open, depending on how young or old they are. But if they are of a certain age, usually we would get them to close their eyes.
What are some issues that children have to deal with?
So similar to the ones that I mentioned earlier, but of course perhaps of a different nature, severity, anxiety at school, a certain amount of stress, so they need stress management. It could be anger management as well. Kids also have phobias, different types of phobias, the bullying thing and how you need to build on the confidence. So that's very closely linked to the anxiety and the stress, because you then have a bit of either school refusal, I don't want to go to school because this person is troubling me, and they don't know how to get it manifested. So sleep disorders.
Wow.
So we have people who come to us because they've got problems with their sleep patterns. Yeah. So, and these are not just apparent in adults. They're also prevalent in children.
Wow. Okay, so I was just thinking about bullying because, as a victim of bullying, how is a child supposed to kind of deal with that in hypnotherapy? I mean, I didn't think that was possible, but
so no amount of telling them that be strong, just telling it in the conscious world may not be enough, but they've also got to forgive themselves, forgive the other party, draw boundaries around themselves.
Wow,
right?
Yeah.
So a lot of all these things are done in it by accessing the inner resources. So the scripts also are very tailored to the individual.
Where are these scripts from? Are they like they've been written, they're out there, or is it something that you come up with in therapy during sessions with the client?
So in our training, of course, there are certain scripts that are shared with us, but usually what is shared is the overall nature of the script. Is this a dissociation script? Is this an inner resource script? And an example is usually given or provided for us. But we are also often encouraged to write our own scripts. And a lot of the scripts that we use have a lot of visualization, a lot of imagery, metaphors. So that's why I come back to the power of the language as well. So you do need to have someone who is like not only familiar with the use of imagery and the use of visualization, but also someone who has the ability then to articulate that and give that as an imprint to your subconscious mind in a calm and in a manner that's reassuring to you.
Yeah.
So it's a combination of various things. It's not just learning hypnotherapy. You do need the other nuanced skills in there.
I kind of imagine it like, what would my mom do in a situation like that? Like if I'm faced with a situation, I can hear the voice of my mom.
Yes.
Like advising me or calming me down or something like that.
So a lot of the time we also tell people in the script that I can assume the identity of someone known to you, someone whom you rely on, who is safe to you, and that is exactly what happens. So if it's somebody that you treat with great respect, or you feel calms you down, and that person's not there at that point in time, then you can get your subconscious mind to kind of say, okay, this is in the voice of my mother.
Okay, wow, that's really fascinating. Okay, jumping back live on air here on 1FM 91.3. Thank you for all the fabulous questions that have come through so far. We're heading back after Paul Abdul. Straight up here on 1FM 91.3, Good Times, Greatest Hits. Good morning to you and welcome to the Brightside. This is Carol and we're joined in the studio by Monica Menon. She is a hypnotherapist at Healing Place SG, casting such a bright light on what this form of therapy entails. So, Monica, off air, we're talking about how hypnotherapy is kind of like driving. When you're driving in certain conditions, you're not really actively thinking about, I got to move the brake, I got to step on this. Can you explain that process again?
Yeah, so the analogy that I gave was how you have something called highway hypnosis. So even when you are driving and you're speaking to someone who's seated next to you, or you're on your car phone, or your Bluetooth, you're not actually consciously thinking about the fact that I need to turn left here, I need to stop at this red light. And in a particular day, you could be driving to different destinations. So you're not consciously thinking about it because your subconscious mind has already taken over. Right? So that is what we mean by hypnotherapy, where your subconscious mind is the one that has accessed the resources, and you're not consciously thinking about some of these things, but you're still able to do them.
Okay. Can you run through with us again some of the clinical applications of hypnotherapy?
Yeah. So some of them include anxiety and stress management. Anger management is another one. Pain management. So that is where, you may want to go to the dentist, but you're afraid of the pain it's going to cause you.
Yeah.
We have got expectant mothers who have come to us for hypnotherapy, and because they don't want to take medication. So pain management is another one. Breaking unwanted habits. We mentioned earlier about, you're just snacker all the time. You want to get rid of that, or you're nail biting, for example.
Are children suitable for hypnotherapy?
Yes, we do that. We do hypnotherapy on children, of course, with the consent of the parent. And sometimes, if they, depending on how young they are, they may or may not close their eyes. They may be engaged in either a bit of coloring or looking at something, playing with some toys while they're talking to the therapist. Older children, of course, we explain the process to them and they do close their eyes. So it's suitable for almost everyone, except perhaps those who have very severe special needs or very severe mental health challenges.
Okay. And how many sessions would you say a client would need to see some kind of effect?
Depending on the severity of it, it could be as little as 4 to 6 sessions, but some more severe cases and complex ones, because sometimes you have one that's linked to another and another, right?
Right.
Because our lives are in many ways interconnected, so those would require a little bit more extensive therapy sessions.
Okay. And what is a side effect that could happen as a result of hypnotherapy?
There isn't any known side effect to hypnotherapy other than the fact that either you may fall asleep during the session, which isn't a bad thing because that's part of also your subconscious world, and you do wake up when the therapist counts up to 10, so there isn't that I wouldn't consider that a side effect. But other than that, other than a bit of drowsiness or lightheadedness when you come out of the therapy session, which is
how we are when we wake up sometimes.
That's right.
We're a bit groggy, we're kind of out of it. We take some time to just wake up, right?
Yeah.
So that's kind of normal.
Yeah.
But what about the positive outcomes of hypnotherapy?
Yeah, so there are many people even after a session who say that, today I was really, really very calm. And, I think the greatest satisfaction for me as a hypnotherapist is when my client tells me something like, for a whole week, I didn't get upset with anybody, or even if I did, it was a light annoyance. Let's say I'm dealing with an anger management issue, and they tell me that. Yeah. So.
Okay, that's fabulous. Thank you so much for sharing so much insight on the topic of hypnotherapy, debunking some of these myths. It's been around for so long, been using it since the ancient Egyptian times, and the Greeks have used it. It's just been misused for stage hypnosis.
Yeah.
And it's gotten a bad rep as a result. But you know what? Hypnotherapy, by and large, can help us with a lot of our day-to-day issues. So, Monica, where can people reach you? How can they contact you?
Yeah, so my Instagram handle is Healing Place SG. Not the Healing Place, but just Healing Place SG, okay, all together. And my mobile number is 83059080.
Okay, can I do hypnotherapy over the phone?
Actually, a lot of people do it virtually.
Wow.
That's a great question, because in the past, everyone felt that you needed to come to a therapy clinic.
Right.
But I have clients as far as Dubai, the UK,
Wow.
Indonesia, who see me online, and that really is it's really fantastic, because you have people from all over the world, sometimes with very similar challenges or issues, and we do it virtually.
Okay, that's good to know.
Yeah.
Wow, thank you so much once again for joining us, Monica. It's been such a beautiful time chatting with you. Now, if you want to find out more, once again, head on over to her IG handle, Healing Place SG, or rewatch this video on Facebook, facebook.com/1FM913.
91.3. Good times. Greatest hits. 1FM 91.